Hi, Assalamualaikum warahmatullahi wabarakatuh, and a very good day to all my students. Today we are going to learn on immune system, and we are going to explore what could be happen when our immune system doesn't work the way it should, and this will result with disease. Okay, the lesson outcomes. So you must be able to describe and explain homeostatic imbalance and consists of immunodeficiency, autoimmune diseases, and hypersensitivities. Now we go into the immunodeficiency. So this is a condition when our immune system resists to fight infections. Okay, there are several examples of the immunodeficiency disorder, such as severe combined immunodeficiency, also called SCID, and acquired immunodeficiency syndrome, or also called AIDS. And this disorder can be congenital, which means it's present at birth, or also can be acquired. It means it begins at one's lifetime. Okay, so this immunodeficiency, it will cause immune cells to behave abnormally. Okay, SCID patient will have deficit number of B and T cells, and this due to the genetic defects, okay, and likely to be found among infants, okay, normally in their first year of life, okay. So the problem with the patient of SCID is they lack of ADA enzyme, which is necessary for the T cell to survive. Okay, children that afflicted with this SCID have no protection, and they can be fatal if left untreated, and normally the treatment is by bone marrow transplant. So this is a condition of normal and person with SCID. A normal person, they have T cells and B cells in their immune system so that they can fight infection. Meanwhile, for SCID person, the immune system doesn't consist of T and B cells. This will lead to the decrease in immune response, and they cannot fight infections. A bubble baby disease is a condition when a person are extremely vulnerable to infectious disease. So this person named David Vetter, he became famous because he lived in a sterile environment, which is in a bubble. And this is from 2014. It's a clinical trial study which is successful for this kid named Evangelina. And this kid, okay, undergone stem gene therapy, okay, and then is one of the successful trial to treat the SCID patient, okay. And the second disease is AIDS, okay, which is caused by the HIV virus, and this virus can be transmitted through the blood, semen, vaginal secretions, and infected mothers also can transmit the virus to her fetus. Commonly enters via antibody via blood transfusion or blood contaminated needles, and also during the sexual intercourse. So these are how the virus can be spread inside our body. And the AIDS, the second immunodeficiency disorder, okay. So AIDS is the disease that is caused by the HIV. So this HIV virus is specifically target. So it specifically targets the helper T cell inside our lymph nodes. Alright, so without the helper T cell, both the cytotoxic T cell and B cell cannot be activated or maintained, and it will cause our immune system upside down. And this HIV virus, they will multiply steadily in our lymph node, and sometimes it took many years inside our lymph node without us notice. And the symptoms only appear when the lymph node can no longer contain the virus and our immune system collapses. So that's the time when the person have symptoms of AIDS. So this about humoral immune response and cell-mediated immune response. Okay, so this is the way how our body detect the presence of the intruders or pathogens, and then how the body respond towards it by produce antibody and also generate memory cells. So this you can revise on yourself by checking notes, or maybe you can surf the internet to get more information, okay, on this both immune response. Okay, for AIDS patient, these are several symptoms that appear: severe weight loss, night sweat, swollen lymph node, increased frequent opportunistic infections like pneumonia, Kaposi sarcoma, and others. And these symptoms may appear 5 to 10 years after the person being infected by the HIV virus. So it takes a long time to appear the symptoms. Okay, so there are three phases in the development of AIDS. Phase 1, it lasts from few weeks to few years after initial exposure to the virus. Normally, a person will have a flu-like symptoms and swollen lymph nodes, chill, fever, fatigue, and body itches. Okay, and during this time, the antibodies do not destroy the virus entirely because this virus remain inside our cells, so that our cells cannot detect the presence of the viruses. In phase 2, it can occur for 6 months or more than 10 years before progress to phase 3. And during this phase 2, the virus begins to do the damage. And this virus later will wiping out more and more of the helper T cells. And at this stage, the person, the infected patient, will become more vulnerable to opportunistic infection like persistent flu-like symptoms. And the last phase is the third phase. So this time, the patient will have a very low number of helper T cell inside their blood. And normally they will have cancer associated with the HIV infection. Okay, and during this, the person is said to have AIDS. There are several cancers that related to AIDS like pneumonia, meningitis, tuberculosis, encephalitis, Kaposi sarcoma, and etc. Okay, so these are the example of the cancer that associated with AIDS. And this is the transmission electron microscope image of the HIV virus budding from the surface of the T lymphocyte white blood cell. And this is the image of the opportunistic infections in AIDS patient. So this is the capsulation, which is the symptoms, the last phase in the development of the AIDS. Okay, so we will continue our lecture on the autoimmune disease in the next week. Thank you, class.